the baby over your shoulder. To initiate burping, acceptable position. Gently pat or stroke the back in an acceptable position. Patting helps the baby bring up the gas and burp. Hold the baby in a sitting position on the lap. To initiate procedure, lean the child forward against one hand with the index finger and thumb supporting the head. This is often the best position to use. Provision of head support while other hands pat baby's back. Spread or place a clean towel over your lap to provide comfort and possible mess or excretion of fluid substances. Gently handle the infant by laying him on his abdomen with his head turned on one side in your lap for easier burping procedure. Pat or stroke gently the infant's back to facilitate burping.